Welcome to this lecture on the evolution of community health nursing. Understanding the historical trajectory of CHN will help us appreciate how past events, policies, and nursing leaders have shaped our present day roles. This discussion is particularly important for us Filipino nurses as we reflect on both global and local milestones that led to the establishment of our modern community based nursing practice. In its earliest form, healthcare was provided within families and communities long before modern health institutions were established. In the Philippines, this meant that healing and health maintenance were managed by indigenous systems of care. Families relied on their elders, midwives, and local healers, notably the helots and arbolarios, who were deeply trusted figures. A helot, for example, specialized in massage therapy, bone setting, and prenatal care. The herbolarios or herbalists used knowledge of medicinal plants to treat common illnesses. These traditional practitioners provided accessible and culturally accepted care, especially important in rural settings with limited access to formal services. While some practices were based on empirical knowledge and observation, others were spiritual in nature, reflecting the community's holistic view of health and illness. Interestingly, these practices persist today, complementing modern nursing interventions and reminding us of the importance of cultural sensitivity in public health. The 19th century marked a turning point for public health and nursing practice globally. The Industrial Revolution led to rapid urbanization. Cities grew overcrowded, living conditions deteriorated, and poor sanitation caused rampant disease outbreaks like cholera, typhoid, and tuberculosis. Governments recognized the need for reform, giving rise to the sanitary movement. Public health acts were passed to regulate waste disposal, water, safety, and housing conditions. At the same time, Florence Nightingale's work during the Crimean War highlighted the connection between environment and health. Through simple interventions, improving ventilation, sanitation, and nutrition, she dramatically reduced mortality rates among injured soldiers. Nightingale also advanced nursing as a scientific profession. She emphasized the use of statistics and observation in care planning, an approach that underpins evidence based public health nursing today. Globally, her ideas inspired reforms that shaped the structure of public health systems, including those eventually adopted in our country. Let us now turn to the Philippine context. In 1901, during the American occupation, the Philippine Commission of Public Health was established. This was to combat disease and promote hygiene in the country. The Americans introduced a formal public health system with a strong emphasis on preventive care and education. By the 1905 to 1920s, nurse training programs were developed, and Filipino women were recruited and educated to serve as professional public health nurses. These early nurses were pioneers. They led campaigns on smallpox vaccination, maternal and child care, and sanitation education in both urban and rural areas. For example, trained Filipino nurses would visit barrios to teach hand washing, assist in childbirth, and conduct house to house public health education, often bridging cultural gaps between Western medical approaches and local traditions. These efforts marked the transition from informal to formal community based nursing in the country. During the Commonwealth era, in the 1930s to the 1940s, the Philippine government moved to strengthen its networks of rural health units or RHUs, ensuring that basic health services were available to even the most remote communities. These RHUs became the backbone of public health, staffed by nurses, midwives, and sanitary inspectors. After World War II, post war reconstruction placed an urgent focus on reducing maternal and child mortality and controlling the spread of communicable diseases such as tuberculosis, malaria, and leprosy. Community health nurses played a crucial role, conducting home visits to track pregnant mothers, educating families on breastfeeding and nutrition, and organizing mass immunization campaigns against polio and measles. This era further established the preventive and promotive roles of community health nurses and underscored their position as trusted health advocates in the community. In the 1970s to 1980s, the primary health care or PHC movement transformed global and Philippine health systems. The 1978 Alma Ata Declaration, championed by the World Health Organization, declared that health is a basic human right and called for health for all by the year 2000. This movement emphasized equity, community participation, intersectoral collaboration, and appropriate technology. In response, The Philippine government established barangay health stations or BHS and trained barangay health workers or BHWs. These are community volunteers who are empowered to deliver primary care and health education. Community health nurses became trainers, supervisors, and mentors to BHWs, ensuring they deliver safe and effective services. For example, during a vaccination campaign, a nurse might organize BHWs to identify children needing immunization, help prepare logistics, and educate mothers about the importance of completing vaccination schedules. This move decentralized significantly and extended the reach of public health services and fostered greater community ownership of health programs. Since 1990s, the scope of community health nursing has expanded dramatically. Nurses today are not limited to direct care. They are health promoters, disease surveillance agents, program managers, and advocates for health rights. For instance, a community health nurse might lead an adolescent reproductive health program, monitor tuberculosis cases through contact tracing, and advocate for clean water policies in local government meetings. Importantly, modern CHN practice emphasizes family centered and community oriented care. This means addressing not only the patient's immediate medical needs, but also considering the family's health literacy, social support systems, and the broader community environment. Thus, CHNs today engage in multi level interventions from individual behavior change to community wide advocacy for improved social determinants of health. On the current trends and innovations, the most recent milestone is the enactment of the Universal Health Care, or the UHC Act of 2019 in the Philippines. UHC guarantees that every Filipino can access comprehensive, affordable, and quality health services without financial hardship. For CHN, this means greater roles in community based health promotion, preventive care, and early detection of diseases. Additionally, UHC strongly emphasizes intersectoral collaboration, like working with local government units, schools, sectors, civil society groups. CHNs now serve as key coordinators in these partnerships. Community participation remains central. Nurses facilitate community organizing and participatory health planning to ensure that programs reflect local needs. Finally, technology is transforming SAGE and practice. Through telehealth, nurses can now conduct remote consultations and monitoring, especially during the COVID-19 pandemic when face to face services were limited. To summarize, community health nursing has undergone profound transformation. It evolved from traditional family and community based care to modern, organized, and evidence based system. Throughout this journey, it has been shaped by global health movements like the Alma Ata Declaration and adapted to the Philippine context through RHUs, BHS, and the Universal Healthcare and several ongoing innovations. Looking ahead, the evolution continues. Nurses must navigate challenges such as pandemics, non communicable diseases, climate change, and health inequities. They must embrace new technologies, strengthen community partnerships, and advocate for a more just and sustainable system. As future community health nurses, you are both the inheritors of this rich legacy and the architects of its future. By understanding this history and applying the lessons, you will be better prepared to serve your communities with skill, compassion, and leadership.